Hi, my name is Dr. Mathew. I'm an oncologist. I'm also an epidemiologist. I'm making this video to answer a lot of common questions that I'm being asked from a lot of my friends. So this video is primarily intended to friends and acquaintances who ask me a lot of questions. I've made a few videos in my language, Malayalam, but this is primarily intended to those who do not understand Malayalam or would like to know more about the SARS coronavirus 2. Now, I'll be answering a lot of questions. I would be highlighting whether these are fact-based or my opinion based on some facts, or whether these are myths or pure speculation. Now, what is SARS coronavirus? There has been a lot of coronavirus infections over the last centuries, ever since man has been alive, I believe. In fact, all of us have had infections from coronavirus. But this particular virus originated in China, in a province near Wuhan, or we think. This belongs to the coronavirus family, but this has different characteristics compared to all the coronaviruses that are floating around in the world. So this virus has a very high infectious rate, which means very high chance of transmission to another person. This virus has comparatively higher rate of causing death compared to the traditional flu virus that is seasonal. This virus isn't as deadly as the Middle East respiratory syndrome virus that was an epidemic in 2012. This isn't as deadly as the virus, the SARS epidemic that existed in 2002 to 2004. But because the infectious rate is very high, there is a lot of chance for widespread infection. And because the denominator is going to be high, there's a chance for more complications and mortality. And as a result, there is a high chance, or we know that for a fact, that the health system will be overburdened by the large number of patients who would flow into the hospitals, which will be too much that a hospital can handle. So let me try to answer a few questions next. All right, these are two questions. What is the incubation period and what is the infectious period? The incubation period is when you get exposed to the virus, and when do you actually get the symptom from the virus. We know that 95% of all viruses or of all SARS coronavirus infections happen within about 2 to 10 days period. But nearly 100% of the infection happens within 14 days of getting exposed to the virus. So that is why the isolation period or the quarantine period is sort of accepted as a 14 days for the most part. What is the infectious period? That is the time duration from when a patient is infectious or can cause another infection to another person. So the problem with this particular coronavirus 2, SARS coronavirus 2, is that infection can happen even from an asymptomatic person. That is, I may not have any symptoms now, no fevers, no body aches, nothing, but I could still be spreading the bug. And that's what makes this really a dangerous virus. The infectious period is thought to be at least a couple of days prior to the onset of the symptom to until the viral shedding is over. We don't really know when that happens, so that's why repeated tests are done. All right. Next common question is this airborne infection? Is this droplet infection? Is this waterborne? Is it foodborne? So one thing is very clear. I'm going to bring up the fact sheet here. One thing is very clear. This is the most common reason patients get infected is through a droplet spread. So if you cough, if you sneeze, if you talk loudly and you have saliva, spittle coming out, there are droplets that come out of it. So if a patient is infected and he or she sneezes or coughs, these droplets can travel in the air and could be inhaled by another person who's standing near or next to that person. And that is how droplet infection comes. And that's why now, traditionally, over the last several months, we have all been talking about social distancing, or rather physical distancing. Stay at least 6 feet apart from the other person. It's primarily because droplet doesn't travel more than 6 feet. Now, is it waterborne? No. Is it foodborne? No. So if you eat takeout food, don't worry. Just clean your hands well and confidently eat it. This doesn't get transmitted through the water or through the food. Now, here's where the next step is opinion. Is it airborne? Now, this is where it gets really tricky. Airborne is when there are small, tiny particles that gets out as we speak or as we breathe. Those could have virus, and those could linger on in the atmosphere for a long time. Is this viral infection considered to be airborne? The World Health Organization believes it is not, that it is primarily a droplet infection. But all of us doctors, all of us in the field uh, have agreed, there's a consensus that we have to be careful when we are doing procedures as doctors that have a high risk for uh, airborne spread, like intubation, like putting a breathing tube, like nebulization. So we've got to be careful. There's a lot of research that's coming out, but one thing is sure, it is primarily droplet. If at all airborne, it's a tiny chance. So don't really worry too much about whether this is airborne or droplet. Just consider it as a droplet infection for now. The next question is heat and humidity. Does heat and humidity help places like India? Are we going to have less problems with this virus? This comes from the studies that have been done till date using coronaviruses infections in the past, using influenza virus infections in the past, which we know that heat and humidity actually reduces the R naught or the reproduction rate. So the R naught, R0 or R naught or the reproduction rate is the number of persons that one patient with SARS coronavirus infection can infect. That is considered to be about 2 to 2.5 for SARS coronavirus 2. It is possible that heat and humidity can actually reduce that transmissibility rate down to maybe 1.5, 1.8. Anything, any reduction would be important for India. At the moment, there is no evidence to suggest that heat and humidity actually helps places like India. So we just have to be cautious. This is both opinion based on some facts as well as common sense. Okay, so at the moment, we hope that heat and humidity would have a beneficial effect in places like India in reducing the risk of transmission, but we don't know for sure. All right, what does flattening the curve means? This has been talked about a lot. What it means is if a lot of patients get infected at the same time, the chances of patients needing hospitalization would be high. So when the number of patients that get infected is large at the same time, a lot of these patients would jam the hospitals and it will overwhelm the hospital system, the capacity in the ICU. So if we can spread it, if we can reduce the risk of transmission, if we can spread it evenly, then hospitals can handle the volume of patients and better care can be given. So that's the whole idea with flattening the curve. And that is where lockdown or restricted social activity and movement actually comes into play. So when you institute a lockdown, as it is done in India now, the number of patients, number of persons, population that are out in the open air is less. So the virus has less host, less chance of finding a host to transmit. And therefore, the number of patients who get infected at the same time reduces. So you can essentially flatten the curve so that all these patients doesn't overwhelm the health infrastructure quickly. So the lockdown has two specific roles. One, it gives you time to prepare the hospitals, the testing facilities. It also helps give good care to those who actually need it. Okay, now this is both fact-based and opinion-based. Are children protected? We know that children suffer less from this infection, um, unlike elderly who die at a higher rate compared to the younger age group. Why is that so? I believe, or there is some hypothesis that this is because the thymus or the thymic related immune system is very much active in children. And this is particularly one of the reasons why influenza is less of a problem in children. And although this is opinion based on some facts, we don't know for sure, but it's a good thing that children are less affected by this virus. That's not to say about children less than infants. I'm not talking about infants, I'm talking about children. So just be careful about that. All right, what is the case fatality rate? The case fatality rate is if 100 patients get infected with this virus, how many actually die. At the moment, we think it's about 1% if the hospital system is not overwhelmed and if good care can be given. But in places like Italy, the rate is 10% or more, and that's because the case fatality rate differs by age. The more elderly a society has, the more chance for the case fatality rate to go high. But if it is well tackled, then I'm sure we can bring it down to about 1%. I think in China it was about 3%. In the US, it's running at around 3%, if I'm not mistaken. But if we flatten the curve, we can give better care to our patients, and we can actually reduce the chance of death from this virus much lower than it is currently. But keep in mind, when compared to flu, the case fatality rate or the number of patients who die from this virus is still at least tenfold. The flu-related fatality rate is 0.1%. In best case scenario, the case fatality rate for SARS-CoV2 is about 1%. That's best case scenario. Case fatality rate differs by age. The older you are, the chance of you dying from the virus gets higher. And that's why people like me are telling everybody, if you're elderly, try to stay indoors. Let's protect the vulnerable, the people who are in the old age homes, nursing facilities, people who are vulnerable. Let's keep them indoors as much as possible so that the virus actually runs through our globe and infects the vast majority of people that it has to eventually, but spares the vulnerable so that we can actually save them and prevent deaths. What is the herd immunity? Just like I was talking about, a virus really have to infect more than half the society for it to reduce its virulence or the chance of causing much havoc. So if this virus actually infects a lot of healthy people and a lot of them actually survive naturally, then the virus will find much harder to find another host to transmit the infection. That's primarily called herd immunity. You can develop it several ways. One is by giving vaccination. The other is natural infection. The British government actually tried to adopt this strategy. They tried to protect the vulnerable and allow life as normal so that all the younger individuals will get infection normally and herd immunity will develop in the society so that the elderly can be protected. But through complex statistical modeling, they realized that that strategy would fail. So there is currently no country in the world that is focusing on such a strategy in tackling this virus that is building up herd immunity. Eventually, this will have to happen one way or the other through vaccines or through everybody getting, or a large part of our society getting infected. We want to allow a lot of healthier people to get infected rather than the vulnerable. So that's why we are doing whatever we can to protect the vulnerable patients with low immunity, cancer patients, older, elderly. So we're trying to protect them. That's what herd immunity is all about. Is a vaccine available? Currently, no. Clinical trials have started. A company has already said that they expect to have trials running soon and to have mass production of vaccine by early January. That's the fastest vaccines would be developed ever. So science has progressed so much that we'll be able to develop vaccines. I'm very confident about that, but it will take time. So until then, we need to protect our patients. We need to protect our population. And vaccine is going to not be easily affordable. So that's going to be a priority issue for countries like India. So at the moment, vaccine is not available. Keep in mind that science and human race have conquered various diseases thanks to development of vaccines. So just like before, we will eventually conquer this infection as well. The clinical spectrum of disease. Well, out of 100 people who get the infection, the vast majority do well. About 80 are perfectly fine. They feel miserable for about 2 weeks and they get better. About 15 have some significant trouble. They need probably hospitalization, they need care, medical care. 5 out of 100 actually need ICU care. They need oxygen, they need additional support. And out of that, we think if you give good care, about 4 would be free of this disease and would live. 1 out of the 100 would probably succumb to this disease. If you end up on a ventilator, the chances of you surviving the ensuing pneumonia is very low. It's currently at the order of 50 to 80%. So we want to prevent patients from getting on the ventilator, from requiring ventilator support. We want to prevent severe infections as much as possible. So that's the clinical spectrum of disease. The worst case happens when the immune system just goes berserk. That's when a lot of the complications from this infection happens. This infection or the disease have been titled as COVID-19 because it started in 19. So SARS-CoV2 is the virus that causes COVID. That's the name of the disease. What are the available tests? Well, testing is the challenge right now. A lot of countries don't have enough sufficient testing strips or testing kits. I'm very concerned about it. But the available tests are basically trying to identify the gene product, the genes, and trying to figure out whether a patient is actually shedding the virus. Another way to assess whether a patient has the infection is by looking at the antibodies that a person produces once they get the virus. That's called antibody test, IgM and IgG. If you hear about rapid testing in the field, a lot of that is talking about rapid testing to figure out what is the burden of disease in the community. But for a patient, the most useful test is RT-PCR based genetic testing. Could an asymptomatic person shed the virus? Yes, that is what makes this virus really challenging to take care of. Usually, if you get a flu, you feel feverish, you feel miserable, and then at that point of time or a few hours prior to that is when you actually shed the virus. So if you stay indoors, if you stay away from others, you don't stand at risk of transmitting the virus. But the problem with this SARS-CoV-2 virus is even a couple of days prior to you having symptoms, you would be shedding it. And that is why it is challenging. And that is why testing people is very important. Because unless you test, you won't know who's the asymptomatic carrier. And that's why testing healthcare workers is important. Because there's a chance that healthcare workers could be infected. And unless you test often, those who are actually working in the hospitals at high-risk environment, you won't be able to catch those asymptomatic persons who are transmitting the virus or at risk of transmitting the virus. So this is what makes the SARS-CoV-2 very unique and different from all the viruses that we have faced till date. The chance of an asymptomatic person shedding the virus. Okay, I'm going to bring up the opinion section here, but this opinion is based on facts. The question here is well, it is well known that anybody who feels sick have to wear a mask, whatever mask, that's fine, just wear a mask, but wear it properly. Healthcare workers at high risk of getting the infection, working with patients with COVID, wear mask. But the key question here is, should general public wear mask? And the evidence is very hard to accumulate, but common sense, in my opinion, based on some facts, suggests that the general public wearing whatever mask you have, cloth-based mask is sufficient and would help reduce the chance of infection. The only problem is you have to wear the mask in a proper way. You have to clean it appropriately. You can't reuse it without cleaning it. You shouldn't touch the outside of the mask. It could be just a handkerchief as well, but something that prevents you from becoming an asymptomatic shedder of the virus. So for the healthcare worker wearing the mask, or for some, why is wearing mask important? So that they don't actually get the infection from a patient who has COVID or is shedding the virus. So they have to wear proper mask, surgical mask or N95. For the common public, masks are in short supply. So the goal, when I believe it, what I believe in, what my opinion is, of recommending the general public to wear a mask if you're in a public transport system or if you're in the market, is so that you're not going to shed the droplets around if you're coughing or if you're sneezing or if you're talking loud, so that the people around you don't get infected. So masks serve two purposes. One, to prevent things from outside from getting into your body, and also to prevent things from your body to getting out. So the rationale for me, and a lot of famous doctors are suggesting the same, scientists are suggesting the same, is so that the general public should consider wearing mask, not the surgical mask, please, because there is a shortfall right now. but maybe cloth-based masks. There are good guidelines available online. In fact, the Office of Principal Scientific Advisor has also recommended using cloth-based masks for the general public. This is mainly so that you can prevent yourself from becoming an asymptomatic shedder of the virus. Okay, so that's my opinion based on some facts. But this is highly controversial. WHO has still not recommended masks for everybody. Government of India has still not recommended masks for everybody, the general public. But the Office of Principal Scientific Advisor for the Prime Minister have recommended it. There are a lot of famous scientists and people who have recommended it. In fact, the most well-known authority on SARS-CoV-2, if anybody can be called that, is the Chinese CDC's chief. He suggested that everybody wear a mask, the general public wear a mask, in a Science journal article a few days ago. He's the most important person right now because he has the most experience taking care of patients with COVID. Most of the publications, most of the data that we have is from his team. So I would strongly consider his recommendations. But please make sure you use it hygienically. You don't touch the outside and then touch your face. You wash it properly. You change it often. A good cloth-based mask, you can go online and find it, is sufficient for the general public. But if you're a healthcare worker, or if you're working, or if you're exposed to patients, taking care of patients, then ideally wear a surgical mask. If you're exposed to high-risk airborne procedures, wear N95. Please reserve those things for healthcare workers. There is a perceived shortage of masks at the moment. Okay, now India is experiencing a lockdown. What after lockdown? I don't think we should extend the lockdown at any go because we are devastating our economy. And in my opinion, any further lockdown is probably going to be counterproductive. What do I think we should do after lockdown? I think we should all be sensible. We should maintain hand hygiene, wash our hands with soap and water several times a day. Don't touch your face, mouth, eyes, nose without clean hands. And maintain physical distancing when you're outside, when you're in the public space. If you have any symptoms, don't hide the symptoms from anybody. Isolate yourself, listen to your authorities. These are things that you as a person can do. There are a lot of things that the authorities can do to help the society. Now, I have written about it in social media. I think ongoing school closure will help. Reducing the number of people on the roads unnecessarily would help. So I would urge continued banning of public gatherings of more than 25, 50 people. So those kind of things can actually help cut down the risk of transmission. I would urge the government to give paid leave to people who are sick, to allow for good isolation facilities, to allow for rotation among doctors and nurses, rather than exposing everybody to the same health system and environment. A lot of things that government can do after the lockdown is over. Is the virus that's running around in India a less virulent type? Is there mutations that has happened? Yes, all viruses undergo some mutation, but compared to the viruses that we know thus far, SARS-CoV-2 has not been mutating that much. And the kind of strain that's running around in India is considered similar to that is happening in the rest of the world. There is currently no evidence to suggest that the virulence is any less for the strain that is running around in India. And also there is very little evidence that the strain that is happening in India or getting transmitted has undergone considerable mutation to make its characteristic any different from the rest of the world. If a person with coronavirus infection, SARS-CoV-2 infection, got healed, is there a chance that that person could be reinfected? This is opinion based on a lot of facts. I think there's good facts that back this opinion. A lot of virologists will agree. The chance of a reinfection is excruciatingly, exceedingly low. There is sufficient antibody that will be in the person who's healed from the SARS-CoV-2 infection we expect for at least a couple of years. So the chance of reinfection is very less. Now, could there be a second wave in places like Singapore and China where they have already controlled the infection and flattened the curve? Yes, there could be a second wave because the herd immunity hasn't developed. So there's always a chance for a second wave. So all countries need to be cautious until at least several months from now, when by then there would be significant herd immunity in the society and in nations. Okay, is this a Chinese conspiracy? Is this a bioterrorism? There's a lot of fake news that's happening. This is actually something that scientists need to evaluate very carefully. So this is now a fact. Scientists from across the world have evaluated this virus, have tested its genetic composition. We have clearly identified this as a virus that cannot be created, built by a human being. This is a virus that has its origin in the natural world. It's very close related to the coronavirus seen in the bat, in a bat species. So we think bats are probably where this virus originated. We also think that there could be a vector in between. A pangolin could be the animal, but the conspiracy that this is Chinese bioterrorism is fake. So don't believe that. The conspiracy that this is American virus is fake. Consistently, scientists have demonstrated that this virus cannot be built by a human being. Why did such a devastation happen in Italy and in New York? Well, first and foremost, they underestimated the virus. They didn't have much time to figure out this virus. We in India have had 2 months. We have had experience from other countries, so we've figured it out well, reasonably well. Italy and New York, being very much highly connected to the China and several other countries, got a higher burden of infected people early on. In Italy, the elderly were affected more, and so that's why you see a lot of deaths happening, and predominantly those deaths are happening in the elderly. In New York City, it's unbelievably busy place, crammed with people. The chance of this virus just transmitting widely in New York was expected, but what people did not expect was this would overwhelm the city infrastructure, the hospital infrastructure so massively. Um, this could happen in any place in the world, but New York would be the most susceptible. If you've been there, you would know that it is the world's capital. It's the hub of the world. A lot of travel happens. It's a busy place. Everybody uses public transport. So this is bound to happen in the New York City. Rest of the world now have time to prepare. So we have to do our job. We have to flatten the curve. We have to prevent our healthcare system from getting overburdened. So please do your thing. Maintain physical distancing. Maintain good hand hygiene. And hopefully we can flatten the curve, break the chain of transmission, and protect a lot of people, healthcare workers, from getting infections and complications. Okay, what are treatment options? Right now, we don't really know what treatment actually works to take care of this virus. There's a lot of clinical trials that's happening. Remdesivir is a drug that was developed to tackle Ebola. It was a failed drug, but there is some anecdotal evidence that it may help patients with SARS-CoV-2 infection. Clinical trials are ongoing. HIV medicine, ritonavir and lopinavir, was trialed. It failed, but the problem is it was used later in the course of disease. If used early in the course of disease, there is potential that it can help prevent a patient from getting too sick. So ritonavir, lopinavir is an option. The Cuban wonder drug interferon alpha really doesn't have any evidence. There's no good data. It has already been studied in a lot of diseases. I doubt if it's going to make any difference. Hydroxychloroquine, azithromycin, clinical trials are underway. I don't think it's going to make much of a difference. So are people using it in treatment? Yes, because we don't have much options, and it is rather a benign drug if somebody has an infection already. But for prevention, I don't recommend it at all for the general public. Favipiravir is a drug developed by a Japanese company. Based on some non-randomized trial, there is evidence that this drug could be a very important treatment option compared to the HIV medicine, ritonavir, lopinavir, but it's not available. So for India, a country like India, our best options are take good care of patients, standard infection ARDS treatment options, and hope for the best. If in severe infections, where patients get really high levels of immune response, tocilizumab is a drug which is an IL-6 inhibitor that has been used in the West with fairly good success, but it's going to be very expensive, and I don't think we can access that medicine in India at the moment. It's called tocilizumab. How long does it remain on surface? This has been studied. In various surfaces, we know how long this virus would remain if a droplet full of virus ends up in the surface. Really, do you need to know all about it? I don't think so. Just maintain common sense. Expect that the virus would last in a steel surface for about 2 days. So that's why I would recommend cleaning surfaces often. So it can remain in surface, and when you touch that surface, you can transmit it to your own secretions, to your own body through mouth, nose, or through the eyes. This is usually the focal point of entry. This virus cannot get into your body in any other port of entry. These are the only ways you could get it. So don't touch your face, maintain good hand hygiene. If you go outside to the market and you have to touch something, don't in between touch your face. So having a mask will help prevent that. Um, Wash your hands properly. If you are in an office, clean the surface where you work often. If you're in a common space, clean the doorknobs, clean common areas, the surfaces, tables, chairs often. So maintain good hand hygiene and physical distancing. So a lot of people are afraid to buy fruits, vegetables from the market because they fear there are things on the surface. Really don't need to worry too much about it. Just bring it home, wash it well, and you should be fine. Um, uh, just do what's common sense. The chance of you getting infection from a droplet that's on an orange is high if you touch the orange and the orange has a droplet with the virus. And after you touching the orange and the droplet, you poke your nose or you dig your mouth or oh, I actually touched my eyes now. Touch your eyes and just rub your eyes. So as long as you wash your hands properly, you bring out a takeaway food and then you use it. You can eat it, but after you unpack the takeaway food, clean your hands well, and then you can eat it. It's not foodborne or it's not airborne. A lot of people are fixated on how long it remains on surface. So really don't worry too much about it. Just maintain hand hygiene. Well, some of you have asked me, how does it affect my life? Well, I'm anxious, I'm scared. I worry if I will bring home any virus and infect my family. This is something that every healthcare workers think and worry a lot about. But more than that, as an oncologist, it impacts my ability to touch my patients, hug my patients, which is one of the key ways I express my empathy to patients. I think it has affected all of us beyond measure, and it will continue to affect us. We would be cautious of each other. We would lose the threshold to which we would visit people. We would touch others. We would hug others. So I am sad that this virus has come into this world and impacted our day-to-day life so much. As an oncologist, it has significantly affected my life and my work. Could you get the infection from pets? The answer is no. So don't worry about that. Some of you asked me, is there a good food for corona? No, there isn't. Just sensible eating, fruits, vegetables, good habit, clean ventilation in the space that you're in, good ventilated rooms with good air supply. Um, Air conditioner probably doesn't help because it's recirculating air. Just sensible eating. You don't need to take any supplements. Just sensible eating. Stay active. Otherwise, you don't need to worry too much about this coronavirus to the extent that you have to change your food habits to protect yourself. Now, this is something that I really care about, the stigma that could happen when you have a coronavirus infection. Currently, the society, there is a lot of stigma associated with it. There is really no reason for us to stigmatize somebody else. It could happen to me. It could happen to anybody hearing this video. It could happen to the most powerful person. Really, what this SARS-CoV-2 has done is it has uh, made every one of us equal. So there is no scope for stigma. Should you release the name of a person who has the infection to warn others? I think there are strict rules not to do it. But if there is somebody who's not compliant with isolation procedures, with quarantining procedures, I think there is a case to make for the interest of the greater society to release their names so that people are warned to be careful and to isolate themselves. So this is an evolving ethical dilemma. What kind of prevention should grocery stores, medical shops, suppliers, and owners and proprietors do, the workers do? I think good hand hygiene, wearing a mask, good mask hygiene. That's something that we all have to learn. It's not easy to learn. Good mask hygiene. What steps can families of health workers take in this time? I think most health workers know to get home and freshen up before they touch anything else with taking a good shower. Family members, really, hand hygiene. Uh, Physical distancing is not possible, so I suggest good hand hygiene. Hand wash often. How can we avoid a US or Italy like situation? Yes, I'm hoping that the heat and humidity will reduce the infectious rate or the transmissibility rate in India. I'm hoping we have learned enough about the virus that people will be want to maintain good hand hygiene, to maintain physical distancing. And I'm hoping that we have prepared enough PPEs, personal protection equipment, and hospital facilities so that our hospital system doesn't get overburdened. So it is possible that we can avoid Italy or America-like situation. Is social distancing more important or is test and isolate more important? I think for a country like India, physical distancing is important, hand hygiene is important, but equally important is to be able to test those who are symptomatic, mildly symptomatic, and to safely isolate them from the society so that they don't transmit for that 14-day period or until they are negative. So both are important, but a Korea-like drive-through testing where they test everybody in the population is impossible. What is currently practiced in India, that is scanned testing, is not prudent. What is ideal is that we allow doctors in the front line, not just in the government sector, in private clinics also, to test patients who have minimal symptoms. Uh, we need to be able to test healthcare workers who work with patients having COVID-19 disease. We need to test them often so that we can pick any chance of a healthcare worker developing the infection. So both are important. Uh, Mental health aspect of citizens, very important. This could really alter the mental health. This could devastate people. This could create a lot of depression. Already I can see a lot of anxiety among people. Please, you don't need to worry too much about it. Just maintain good hand hygiene. Wear a mask if you're in the public spaces, markets. Maintain good mask hygiene. Wash your hands often. Don't touch your face, nose, eyes, and maintain physical distancing, and you'll be fine. Is it better to have mild infection for everybody rather than lockdown so that everybody will get herd immunity? Yeah, but we shouldn't allow our healthcare system to be overburdened. And that's the whole idea with flattening the curve. So it is indeed better to develop herd immunity, but a sensible way of developing herd immunity is through vaccination. It will take time for us to develop the vaccines. Until then, we need to allow this infection to spread in a controlled fashion. Is the route of entry respiratory route alone? If you consume raw food, which we cannot wash with soap or alcohol, will we get infection? Can the virus cross the gastric barrier? At the moment, there is no evidence to suggest that the virus can cross the gastric barrier. Route of entry is considered oropharyngeal route, mucous membrane in the eyes, nose, respiratory mucous membrane, and oropharynx. Consume raw food that you cannot wash with soap or alcohol, can we get infection? Very challenging, I would say unlikely, very unlikely, but wash it well. What are the common symptoms and the most common symptoms? The most common symptom is fever. About 85% of patients would have fevers, body aches, cough, gastric disturbances, nausea, vomiting can happen. Some patients have diarrhea. A lot of patients lose their sense of smell. So these are symptoms. Some rash is not a symptom. I don't think so. Rash can develop in patients who are on some other therapy, like patients who are on chemotherapy or immunotherapy could get worsening of the rash. Community transmission, is it happening in India? I think we are seeing community transmission. There is a lot of patients who we don't know, we are unable to identify a source of infection. So is community transmission happening? Yes. Why isn't the government not declaring it? I think because we don't have adequate testing. If the government declares that there is community transmission, they should also ensure that there is adequate testing facilities available. Right now, we don't have that. And also to not create panic. But why are we in lockdown mode? Because we believe there is some transmission that's happening in our communities. So sensible thing to approach is that we are already in stage 3 of the disease and the transmission is happening. Should we extend the lockdown period? Not at all. It's already creating a lot of havoc. I think there is chance for people to get tired. There is fatigue, response fatigue can develop. People would not be compliant. The economy will be devastated. More people would die from complications of losing revenue, losing their daily wages than from the infection itself. So lockdown, the whole purpose is to help flatten the curve, break the chain. and to help us prepare PPE and adequate health care infrastructure and testing. Beyond that, the strategy to adopt is break the chain. How do you break the chain? Hand hygiene, physical distancing. That's the only way we can move forward. I think that sort of answers a lot of questions that I've got to now. Now, a lot of you may have more questions. Feel free to ask me. I'll try to answer as and when I can. But one thing you need to remember is the world has seen numerous such incidents, numerous such viruses and infections. We're not going to end the world with this virus. We have had major suffering, but we're going to overcome this thanks to good science, thanks to good leadership, and brave people who are at the front lines, cleaners, hospital staff, essential workers, grocery staff, bank workers, cleaners, all sorts of people who are protecting us, policemen, security personnel who are keeping the society running. A famous king, we think it's Solomon, was once asked, can you give us a sentence with 4 words that is applicable to any scenario? He thought for a while and he answered, this too shall pass. If it's a happy incident, that will also pass. If it's a very sad state of affairs, that will also pass. This too shall pass. So SARS-CoV-2 virus pandemic will pass. We need to think about how to live when that actually has happened. Are we going to close our borders, close our homes for others? Are we going to go into a very parochial mindset? Are we going to think about the other person as an alien? Or are we going to love each other more? Are we going to have hatred in our society, or are we going to love more? Are we going to live with optimism, with more scientific nature in our mind? That's what's going to be key. There are 2 routes that we can take as a society after this too shall pass and have passed. And one route is that of a closed down society. Every border is closed, every country is closed. Paranoia, parochialism, reverse globalization. The other route is of increasing transparency, of increasing of increasing love, of increasing collaboration and societal understanding and mutual love. I would urge that we adopt that second route, and that's the only way we can conquer this disease. Thank you for listening. I hope I have answered a lot of your questions. God bless. Have a good day or night, wherever you are.